Today we're going to talk about images of the lymphoidal tissue. We will talk about the different cells that are in the lymphoidal tissue, the architectural makeup of the different organs, and how it facilitates their function, either filtration or the production of lymphocytes, and that's what we'll be talking about today. Images of the lymphoidal tissue. Hi, I'm Larry Johnson. I'm a professor at Texas A&M University, and today we're going to be talking about lymphoid tissue, the gut-associated tissues as well. So we start out with the lymph node. We can see a lymph node has a capsule. You can see the capsule around it here and there. We can see the capsule all the way around. And you have these follicles that are located in through here, through there, germinal centers. You can see where blood supply comes in around these, and so the blood side comes in and out this hilus region, which is right in this region, one region. Blood comes in, and the lymph exits the lymph node at a certain place at this hilus region. So if we look at that, we see the capsule, and these are afferent lymphatic vessels. That is, these are vessels that are located all along through here, and they bring lymph into the lymph node. Even though it goes out only in one place, it comes in multiple places. And below the capsule is a subcapillary sinus right in through there. We can see it. So this is the endothelial cell lining this afferent lymphatic vessel. And here we see a germinal center located in through here, and this is like a follicle with germinal centers in it. And if we take a look at one of these specimens, this is a 166, and we can see the germinal center in through there. We can see the capsule. So this is a cortex and a medulla located in this region. So if we take a look at that specimen, we will be able to see that. And here we can see that specimen. There's the afferent lymphatics coming in, but this is the efferent lymphatic going out. And so you can see that, the capsule. And below the capsule, you have this space in through here where the fluid can percolate down in through there, and that is a subcapillary sinus. So the subcapillary sinus is all in through there. Let me see if I can get it better right in through there. We can see it very nicely, where fluid can percolate down through the lymphocytes and go through the germinal centers. As they go through here, you can see blood sinuses, and there's lymph sinuses, and there's cords in between. So you have blood sinuses, lymph sinuses, and cords in the lymph node. So if we take a look at that, we can see that. And here's another lymph node, slide 44. You can see the germinal center, medulla, and the cortex here, the capsule, the subcapillary sinus in through, and the medullary sinus. So this is the medulla, cortex, and the capsule. So if we take a look at one of these specimens, we can see it here. We can see again, we can see the capsule and the subcapillary sinus. You can see right in through there. So afferent lymphatics come in through there, percolate down through these, and ultimately it goes into the sinuses to ultimately be so it comes from the cortex down into the medulla. So what we see there is the lymphocytes. There are T and B lymphocytes that are located there. So we take a look further. There's another lymph node. You can see the reticular fibers. So this is stained, silver stained, and you can see how the reticular fibers, which are branching collagen, type 3 collagen, branches, and it makes a kind of like a fish net that the cells percolate. As they percolate through here, they're like a ping pong machine to hit that as they percolate down through there. And then we have reticulum cells, which produce the reticular fibers. So this is a big cell with a big nucleolus and euchromatin, and then here we can see the reticular cells. And so reticular fibrostroma functions as a structural port of the lymph node. So if we look at 45, we can see the capsule around it, and you can see it's not stained for the cells. What you're seeing is the fibers. So we could see those. That's on slide 45, and you can see there's a capsule in through there, and then you can see the reticular fibers, blood vessels in through there. And so you would have the cords, you would have blood vessels, you would have the lymphatic sinuses as well, is what you'd have. And so we go back to here, and we see a lymph node again. We can see some small lymphocytes in through there, and in the middle you see the germinal center. So this is a germinal center of one of these nodules. I call it follicle, or you really could say nodule, of lymph nodule material. So if these T and B lymphocytes, and they respond to the antigens that may be coming through. So here's the capsule of a lymph node again. Here we see in green the subcapillary sinus, and then the sinuses, the lymphatic sinuses that go through there. And that's what we're seeing here and here. And in between there we have cords of cells. So these are cords of cells. And then you also have vasculature. This is the blood sinuses, lymphatic sinus, blood sinuses, and a lot of lymphocytes located there. Here's another one. You can see lymphatic sinuses here, here, and here, and the cords that go in through there. I really can't see blood vessels. There's a blood vessel right there, a little capillary. There's another one right here. So if we take a look at this specimen, we can see it. And if we take a look in there, we can look in here, we can see the subcapillary sinus very nicely in through there where lymphocytes are going through, and this is mostly lymph that we see in through there. The germinal center of this kind of nodule, cortex, and then the medulla. And in the medulla we see the cords in through there, and then the sinuses. So these are the lymphatic sinuses, and then you have the vascular sinuses, which is where the blood vessels are. So you have capsule, cortex, medulla, and these sinuses, lymphatic sinuses, are going to drain out through the hilus region, is what they're going to do. So if we look again at the lymph node, we can see where you have afferents and then efferents going in through there. Artery and vein goes in right in through there, right under the lymphoid nodule or germinal center follicle, is where you have these post-capillary high endothelial venules, so special blood vessels that allow lymphocytes to come out of the blood into here. Lymphocytes don't leave there, but they do come out of the blood into the lymph node at that point in time. And here we can see some of these high endothelial venules. This is the parafollicular region, and you can see the high endothelial venules. And so if you look at it, a normal endothelial cell would have like a flattened nucleus, but here they're more cubed, intermediate, more cubed shape than what you see as a typical one. So we can see those right next to the follicles in this slide 116. So let's take a look at that. So these are the follicles. So we're going to look right in those regions right there, parafollicular regions, and see if we can see some of those. Lo and behold, we see some of these. This here typical endothelial cell here, and then these are the high endothelial venules. In fact, that's what these are, guys, right here, are high endothelial venules. There, and that's right in the parafollicular region. And so the cortex, the follicle, germinal center, parafollicular region is where you have these high endothelial venules. And this the source of T and B lymphocytes coming out of the blood are going into the lymph node. So if we look at a lymph node in 44, we can see macrophages in there which gobble up things and present antigens to the lymphocytes. We also see reticulum cell. The reticular cell actually makes the reticulum fibers, plasma cells to produce antibodies, and the high endothelial venules. So we can see the high endothelial venules here and over there too, and that's the source of lymphocytes getting out of the blood. If we look at this in slide 44, we can see, if we can see that, we see the subcapillary sinus, the follicles here, here, and here, and right in through there we should see the high endothelial venules. So right in through there you can see these cells are a little taller than your typical endothelial cells. So you see that right in the parafollicular region, right in through here and here is where we have these high endothelial venules. They're not flattened, a characteristic of regular venous tissue. So if we look back again, we can look at the high endothelial venules in through here and here, and it's in the parafollicular region. So there's the parafollicular region, right in through there is where you have those. So as I mentioned, the parafollicular region, you have these postcapillary venules where you have T and B lymphocytes coming out, but they come out of the blood, but they re-enter the blood through the efferent lymphatic, which goes back to the thoracic duct and then it enters into the bloodstream again. So the lymph enters back into the bloodstream, but it does it through the thoracic duct. And here we can see the gut-associated lymphoidal tissue. You can see these guys right here. These are prior patches of the germinal center. And here we can see the intestinal absorptive cells, the goblet cells, and the M cell. The M cell is the one that's presenting the antigens to it. I don't have 62, but here's 63 that we have. Back up there, and we can see here. You can see the lymphoidal prior patches of lymphoidal tissue. This happened to be in the appendix, and we can see a lot of goblet cells, a few intestinal absorptive cells, a lot of lymphoidal tissue that we can see. So this is the lymphoidal tissue is right in the submucosa, and the lamina propria is where you can find those. And so if we look, you can see prior patches in the human's appendix, as you can see right here. This is most as a germinal center, and it doesn't have a capsule around it. Here we see lymphoidal tissue in the stomach. This is a Fundic stomach, and if we take a look at slide 145, we can see the lymphoidal tissue, a germinal center, a lymphoidal nodule that's low here with the T and B lymphocytes located right there. And so we can see that here's the chief and the parietal cells. These are parietal cells here, the chief cells of the stomach. But this is a lymphoidal nodule we're supposed to look for. We see these big cells here, which are reticulum cells, right there, and those are from the mesoderm. So if we look at this again, that's the stomach, and then also in the esophagus. So you have lymphoidal tissue in the esophagus as well. So that's one of the things we want to look at, is the esophagus, and you can see the lymphoidal tissue here that's located with the germinal center, and many lymphocytes ultimately interacting with the surface that we have there. And then if you come on to the tonsils, here we see tonsils. This is non-keratinized stratified squamous epithelium and lymphoidal tissue in the tonsils. So if we look at this slide, we can see the tonsils. So we can see stratified squamous epithelium non-keratinized, which is in the oral cavity, and then you have lymphoidal tissue and through here lymphoidal follicles that are located there. But again, you don't have a capsule around it. Is what you have. And so the tonsils, we can see more tonsils there at the here, and so we can look at these at the we can look at these on the tongue. This is on the surface of the tongue. So this is stratified squamous epithelium. This is connective tissue below, and we have a lymphoidal tissue with a germinal center. So this is on the tongue that we have. And so see the tongue. Another one is the spleen. It has a capsule in through there, but it doesn't have a cortex and medulla. It has white pulp and red pulp. And the white pulp is where you have all the lymphocytes, and the red pulp is where you have blood and whole blood. So here we can see it. Capsule. This is a blood vessel. This is a pararterial sheath going through there. That's what these guys are. You have a central artery, which is almost never in the center. You see it over here to one side. And then you have the white blood cells around it. So you have red pulp and white pulp is what you see. And so you see blood vessels come in through there, go through the pararterial sheath, and the sheath of lymphocytes are around there. And then right in the marginal zone, right outside the white pulp, in the marginal zone, is where we see penicillary arteries. So these are little arteries that you see there. The penicillary arteries that facilitate dumping blood into whole blood into the dumping whole blood into the spleens, the strands of the spleen. So here we see a strand of the spleen with the penicillary arteries in through there. These are the litteral cells in through there, which line these blood sinuses. And so here you can see the litteral cells right in through there, and the cords located in through there. And these cells lining these litteral cells are long cells, and the cells has to squeeze through them to get back out. So on this one we see the spleen. This is white pulp, and the other one is red pulps, and these are trabeculae or connective tissue that runs through there. Again, you can see the white pulp sinuses in through there. If we look at this spleen 47, we are able to look at that, and we see the white pulp and the red pulp and the capsule. And you don't have, all you have is the cords and the blood vessels. You don't have a lymphatic sinus like you do in the lymph node. But we basically we have a similar type thing. There's a capsule, no subcapillary sinus, because you don't have afferent lymphatics going in through there. There's not blood vessel going through there very nicely. You can see the smooth muscle cells of it, and you can see the endothelial cells lining the lumen, these kind of flat cells that we have here. So if we look at this again, we can, and that last one we're going to look at is the thymus, and the thymus reduces in size with age. So this is from a child and from the adult. It's kind of small. In the thymus you have the cortex and medulla. And here, diagnostic for those are the hazardous corpuscles. You can see those. So here you see the hazardous corpuscles. You can see medulla and the cortex, medulla cortex. So it's in different lobes. So here you see the different lobes. And we take a look at 48. We can see the different lobes, germinal centers. I have the capsule that they have. You can see the rhynchocrystalline structures in the cortex. So that pretty much brings us to the end of images of lymphoidal tissue, lymph nodes, and a gut-associated lymphatics. Thank you.